As public displays of drug use, people in various states of zombie-like behavior and violent assaults and crime plague the streets in increasing numbers due to the raging opioid crisis and its fallout, it leaves many wondering, how exactly did we get here?
But as far as I'm concerned, the federal government's the biggest drug dealer in the entire country. It's unacceptable. It needs to stop. We need to get rid of safe supply. We need to put money into treatment, detox beds. That's what we need to do, not continue to giving people free drugs.
As described by a publication in Harvard's School of Public Health, the opioid crisis has been the most catastrophic public health disaster of our time. It began in the mid-1990s when Purdue Pharma aggressively promoted OxyContin as a legal prescription narcotic, and the FDA approved it. This set off the first wave of deaths tied to prescription opioids. The crisis then spiraled into a second wave as the heroin market expanded to feed this growing addiction. Now we're faced by a third wave driven by illegal synthetic opioids like fentanyl. The fallout has been devastating. Millions more are suffering from homelessness, job loss, truancy, family breakdowns, and extreme public safety issues. It turns out that just as all of this was unfolding in the mid-90s, in swooped George Soros and his Open Society Foundation to, apparently, save the day. Described as the man behind the curtain in one novel, Soros is a billionaire investor and philanthropist, known now to many for his political meddling. And of course, he also has his hand in the fact-checking cookie jar. His public benefit corporation, called Good Information Inc., claims to be the lifeblood of democracy by restoring social trust and strengthening democracy by investing in solutions that counter disinformation. They even offered to pay this lawyer and social media influencer $400 to do so, except what they tried to do was to get him to make blatantly false claims. Listen to this.
I'm going to refer to this person as Jane. Jane sent me a message letting me know she represented the Good Info Foundation and that she was willing to offer a paid collaboration to discuss some topics related to January 6th. I said, sure, why not? I'll learn some more. Jane says the Good Info Foundation will give me $400 to make a post on my page and then share it to Instagram. So you see that blue link? All right, here we're going to follow it. These are the specific requirements in order to obtain that $400 of how I should refer to the January 6th Capitol raid. Number one, I must call this a criminal conspiracy. Number two, I must say Trump Republicans were responsible. Number three, I must frame it as an attack on my country, an attack on America or Americans, a criminal conspiracy, and a committed crime. I must attribute the matter to MAGA Republicans. I must make clear that this was ongoing and unresolved, and most importantly, that I must channel all of this unto the manipulation of voter agencies so that I could turn their anger around this event into defiance that would make people more likely to vote in midterms. And the thing that struck me the most was this part, where I was told to talk about the aspects of the Trump campaign's plan, and I was supposed to say that the Trump campaign paid literally millions of dollars to make January 6th happen. So I figured, maybe I missed something. So I said, hey, Jane, what is the basis for the claim that the Trump campaign itself paid millions of dollars to make the January 6th siege of the Capitol happen? Jane doesn't answer the question. Hi, Preston, if you don't want to state that in the video, it's fine. You don't have to use all the bullet points provided. So I kept going. Sure, I am just wondering if there's support for that claim. Jane doesn't answer again. Let me know if you are interested and the rate works for you. Thanks so much. I'm not interested and the rate doesn't work for me.
This questionable character and serial narrative controller has 3 decades of drug policy reform work under his belt. Open Society, led by founder George Soros, has been the largest donor in the global effort to reform drug policies and advance so-called harm reduction strategies with over $400 million invested, and have championed what they call a health-centered approach to these issues. Part of this work was undertaken with Ethan Nettleman from the Drug Policy Alliance, who said drug prohibition laws were, you guessed it, based on racist white supremacy.
But when hundreds of thousands of Chinese started showing up in my country, working hard on the railroads and the mines, and then kicking back in the evening, just like they had in the old country with a few puffs on that opium pipe, that's when you saw the first drug prohibition laws in California and Nevada, driven by racist fears of Chinese transforming white women into opium-addicted sex slaves. The first cocaine prohibition laws, similarly prompted by racist fears of black men sniffing that white powder and forgetting their proper place in Southern society. And the first marijuana prohibition laws, all about fears of Mexican migrants in the West and the Southwest. And what was been true in my country is true in so many others as well, with both the origins of these laws and their implementation. Put it this way, and I exaggerate only slightly. If the principal smokers of cocaine were affluent older white men and the principal consumers of Viagra were poor young black men, then smokable cocaine would be easy to get with a prescription from your doctor, and selling Viagra would get you 5 to 10 years behind bars. I used to be a professor teaching about this. Now I'm an activist, a human rights activist. And what drives me is my shame at living in an otherwise great nation that has less than 5% of the world's population, but almost 25% of the world's incarcerated population. It's the people I meet who have lost someone they love to drug-related violence or prison or overdose or AIDS because our drug policies emphasize criminalization over health. It's good people who have lost their jobs, their homes, their freedom, even their children to the state, not because they hurt anyone, but solely because they chose to use one drug instead of another. So, is legalization the answer? On that, I'm torn. 3 days a week, I think yes. 3 days a week, I think no. And on Sundays, I'm agnostic. But since today's Tuesday, let me just say that legally regulating and taxing most of the drugs that are now criminalized would radically reduce the crime, violence, corruption, and black markets, and the problems of adulterated and unregulated drugs, and improve public safety, and allow taxpayer resources to be devoted to more useful purposes.
Except that's not how it's all played out. And here in Canada specifically, it was the opposite. Under a radical decriminalization pilot project, the province of British Columbia saw a 16.5% increase in overdose deaths as despair and disorder wreaked havoc on the streets during the first 15 months of this radical policy shift. The policy, originally developed in 1995, was meant to prevent HIV among IV or intravenous drug users. But it only took 3 years, and by 1998, this harm reduction strategy was pivoted to kowtow to drug addicts and shifted to building political acceptance for overdose prevention sites. By 2002, the Open Society was securing international funding for harm reduction, with the Global Fund contributing over $800 million to harm reduction efforts worldwide. Within 10 years, by 2005, there was an expansion in access to treatment, which helped line the pockets of Big Pharma through drugs used to treat opioid use disorders, such as methadone. By 2006, these radicals were coming to Canada. They formed the first International Drug Users Congress in Canada, and they went to Vancouver, issuing the Vancouver Declaration, which sought to establish the rights of drug addicts to reclaim the right to be their own spokespersons, striving for self-representation and self-empowerment. In 2010, the Open Society led a coalition to reform what they call, once again, racist drug laws. Pushing global commissions on drug policy reform ever since, the last decade or so has been dedicated to prioritizing the rights of criminals, drug dealers, and drug addicts, diverting taxpayer dollars to fund safe supply and harm reduction materials and support these efforts, like syringes and the actual drugs, while establishing safe consumption sites. Except none of this is safe, and it certainly hasn't reduced any harm. Instead, these global decriminalization and normalization efforts have brought us here to today, as the province of Ontario walks back its safe supply and safe consumption site initiatives, with Premier Doug Ford calling these strategies the worst thing to happen to communities. He even goes so far as to refer to the Justin Trudeau Liberals as the biggest drug dealers in the country, with their failed $1 billion federal drug strategy. Listen to this.
Giving someone, an addict, a place to do their injections, we haven't seen it get better. This was supposed to be the greatest thing since sliced bread. It's the worst thing that could ever happen to a community to have one of these safe injection sites in their neighborhood. The other problem I have was with the federal government. You know, safe supply. They get to go up there and get endless amounts of drugs. And guess what they do? They go out and they sell it and get other people addicted. And then they go and get even stronger drugs. But as far as I'm concerned, the federal government's the biggest drug dealer in the entire country. It's unacceptable. It needs to stop. We need to get rid of safe supply. We need to put money into treatment, detox beds. That's what we need to do, not continue to giving people free drugs.
As communities descend into chaos with rising crime, violence, and theft wreaking havoc on neighborhoods, it's apparent that these so-called evidence-based solutions have done little to restore order. Instead of alleviating harm, they've contributed to an even greater breakdown in civil society, leaving those who simply want to live peacefully struggling amidst the fallout. For Rebel News, I'm Tamara Ugolini. We've been following these issues at fixourcities.com. That's a special website dedicated to support our journalistic efforts and shed a light on what is happening in towns, cities, and communities all across the country. To support our work, sign our petition, and sign up so you never miss a report. Head on over to fixourcities.com.